Leader of the Green Party.
Honourable Speaker, it's a solemn day, as was reflected on the front steps of this building at the noon hour. Since the toxic drug crisis was declared a public health emergency 9 years ago today, we have lost more than 16,000 British Columbians. Mr. Speaker, we must make every effort to avoid normalizing this emergency and continuing with business as usual. I recognize the efforts this government has made to address the crisis, but, Honourable Speaker, it is not enough. Not when we continue to lose loved ones, 5, 6, and 7 every day. Through you, Mr. Speaker, to the Premier, does he see a day when we can set aside political calculus, as we did during the other recent public health emergency, which was COVID, and implement the evidence-based policies that are urgently needed to save lives?
Minister of Health.
Thank you so much, Honourable Speaker, and thank you so much to the member for the question and for noting that today is indeed a very solemn and somber day. On this 9th anniversary of the declaration of a public health crisis, a toxic drug crisis that has taken the lives of over 16,000 British Columbians. Mr. Speaker, each and every one of these people was loved. They were daughters and sons, some were mothers and fathers. Each and every one of these people is grieved by the people that they've left behind. And it's important that we always remember these people, their families, and put them at the center of the work that we're doing. I appreciate the support of the member opposite, Mr. Speaker, in the work that we are doing, and his encouragement for the work that we have to continue to do, Mr. Speaker. That's why we, as a government, have invested so much into a full continuum of care, providing supports for people at every stage of the journey that they are facing in battling their addictions. Mr. Speaker, we have a lot more to do, but there are new services. There are new treatment beds, over 750 publicly funded new treatment beds, Mr. Speaker. We are continuing to build out services for youth, for Indigenous people, for women, and ensuring that people have access to the full continuum of supports that they need. Thank you, Mr. Speaker.
Member supplemental.
Thank you to the Minister. 9 years of an emergency and drug poisoning continues to be the leading cause of death among people aged 10 to 59. Mr. Speaker, I'm failing to hear the urgency. Report after report, experts continue to provide this government with the solutions needed to save lives. More treatment beds, prescribed and non-prescribed safe supply, regulated and evidence-based treatment services, and more of them, barrier-free access to health care that can be a starting point for healing, and accessible housing for all, basic human dignity. After 9 years, I think it's time we recognize that every drug death is a policy choice. Through you, Honourable Speaker, again to the Premier, the evidence, research and policy solutions are in front of us. When will this government make the changes urgently needed to save lives?
Minister.
Thank you, Honourable Speaker, and I don't disagree with the member at all about all of the supports that he has listed, and that is why this government will continue to add new resources, as we did in this year's budget, to continue to support people through every stage of their journey. Mr. Speaker, whether that's harm prevention services like take-home naloxone kits, like drug checking services, like overdose prevention services to keep people alive, connecting them to the supports that they need, Mr. Speaker, building more treatment and recovery beds, Mr. Speaker, adding mental health resources for adults and for youth alike, Mr. Speaker, working with First Nations on 8 new Indigenous-led treatment centres, Mr. Speaker, 2 that are already open, more that are underway, continuing to do the work that is needed. There is a sense of urgency, and Mr. Speaker, while we know that we know that lives lost to the toxic drug crisis are starting to come down, we cannot lift our foot off this gas pedal. We have to continue to invest. That is what this government is going to continue to do, and I look forward to the support of all members of this House in doing this work. Thank you.